Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. I want to do this video addressing two separate topics, but both concerning the same subject, heart surgery. These topics come up frequently, at least once a week, if not more. I'm going to try and address them both in the same 10 minutes that I have in this video. So here we go. The first one pertains to cardiac rehab following any kind of heart surgery, open heart surgery, or any of the other surgeries that they do through transcatheterization. Okay? Cardiac rehab is done once you're cleared by your doctor to do. Cardiac rehab is not about how fit you are when you go into this heart surgery. It's not about getting to the gym. Okay, what cardiac rehab is a monitored program. It's not a gym. Yes, when you go in there, you'll see a room set up like a gym with all kinds of equipment, but it's more than that, because you'll also see a desk where at least one staff member, usually a nurse, is monitoring a whole bunch of monitors. You are connected to a telemetry device which transmits information about your heart to that nurse or tech at the desk as you're doing certain exercises. Okay? And what they are watching for is irregular heartbeats, perhaps escalating heartbeats, perhaps crashing heartbeats that you're not going to feel on your own in a gym unsupervised. And what happens is, if the nurse or tech sees something like that, they can intercede, stop you from whatever exercise you're doing, give your heart a chance to recover, and determine then if they're going to have you continue. Okay, the big difference with cardiac rehab is that it's a proven fact to lower the risk of a future heart event, especially those that are fatal, by up to 35%. That makes a huge difference. Again, this isn't about what kind of physical conditioning you're in. Okay? This is about having somebody watching your heart as you exercise to make sure that your heart is recovering in the way that it needs to. Now, of course, we've got insurance. Now, there's a chance that insurance is going to, poo-poo the idea of cardiac rehab. They may say, you're only 42 years old, you don't need it, you're young, whatever. No, you have to advocate for yourself. You get your cardiologist or your surgeon to advocate for you. It's in your best interest if you do it. Okay? Second, or additionally, don't let peer pressure decide what's best for you, especially from those keyboard warriors on social media. I didn't need it. You don't need it, or whatever. This is a decision that's best between you and your doctor. Now, of course, it does cost money. So if you're in a situation where insurance isn't covering as much as you need, speak to a case manager. See if there's a way that they can lower the rates down to, say, Medicaid rates or cash rates, or any other kind of assistance that they can offer. But if you've got the chance for cardiac rehab, let me tell you, it's a good thing to have. I've been through it 3 times. I had open heart surgery and I had 2 catheterizations done. And I'll go even one better. I had a carotid artery done, but I only had cardiac rehab 3 times. I went through it each time. And in those 3 times, I did witness nurses stopping at least a handful of other patients who got attention through the monitors. One was taken out on a stretcher. He was alert. He didn't look like anything was wrong with him, but whatever was showing up on the monitor was concern enough to get him to a hospital. You don't get that in a gym. And chances are you're not going to recognize something going on with your heart, whether it's AFib, any other kind of heart rhythm, or out of control heart rate. You need to have that done by the nurse in cardiac rehab. Now, the other conversation that came up, flying after heart surgery. Now, this is a big one, but again, Don't deal with the keyboard warriors on social media. Don't take advice from them. Okay? What you need to do if you're suspecting that you're going to have to fly, whether it's flying home from the surgery, if you have to fly to a facility to do that surgery and you have to fly home, or if you have a vacation planned, sometime soon after the heart surgery, make sure the doctor is aware that you have these plans. Let the doctor give you the advice of what you need to do. Okay? There's all kinds of risks of flying following heart surgery. And again, it doesn't matter if it's open heart or catheterization. Okay? Cabin pressure is the biggest thing on there. Okay? Puts a strain on the heart. Okay? You also may have the possibility of having to deal with low oxygen, blood clots. People have died on airplanes having blood clots. Okay, following heart surgery, you run that risk. Of course, there's issues with the wound healing, infections, and of course, people flying when they're sick. The last thing you want to do is be exposed to RSV, COVID, the flu, and let's not forget now, we also have measles. Okay, any kind of sickness like that, when you're recovering from heart surgery, can be disastrous in your recovery. These are all things that you have to think about. Now, typically, recovery time is like 2 to 6 weeks when it comes to open heart surgery. But again, that's after the advice from your cardiologist slash surgeon. I know for me, following my open heart surgery, I wasn't even allowed to drive a car till at least 8 weeks. So I don't recall if I flew anywhere after that open heart surgery, but I can tell you that my other two heart surgeries that I did have, one was for a stent and one was to replace my aortic valve. I did have to fly to where I was having the procedure done, and I had to fly home. Okay, and what I had to do was I allotted extra time before flying back home to make sure that I wasn't having any complications from the surgeries. And then I got the approval to fly home. Had I not gotten the approval to fly home, I probably would have had to rent a car and drive. Okay? Now, here's the big thing. If you're flying on an airplane following heart surgery and something goes wrong, you have no ability to access emergency care. Sure, if you get lucky and find and have a doctor on the plane that can, do CPR on you for the rest of the flight until it is able to land at the nearest airport, okay, great. But if not, you're taking that huge chance. So, like I said, when it comes to flying, I'm not going to tell you not to do it, but I'm also not going to tell you it's okay to do it. This has to be a decision between you and your doctors, okay? And it can make it a lot easier with your plans if you speak to them before the heart surgery is done. And yeah, if you have to delay it, you have to delay it. That's just the way it is. It's better off that way. I unfortunately, in all my years of being an advocate for cancer patients and survivors, I've seen this end terribly. And I really wish there were other endings to these stories. Doesn't happen to everybody, but then again, do you have the crystal ball that you can confirm that you're going to be the lucky one or not? So what I would ask is just take these two things these bits of advice that I've given you in regard to cardiac rehab and flying. Take them seriously. Speak to your doctors before you make any decisions. That's where you need to get that advice from. Until next time, this is Paul's Heart.